This YCN segment is brought to you by New London Hospital, an affiliate of Dartmouth Hitchcock.
Welcome back. We're here at Colonial Pharmacy in their lovely new location on Newport Road in New London, New Hampshire. And joining me now is owner and pharmacist Glenn Perreault. Nice to see you.
Nice to be here. Thank you.
Thanks for hosting us again.
Thank you.
Tell us a little bit about all the new improvements with the pharmacy with the new building.
So, in the old pharmacy, we were cramped, restricted.
Yes.
We're excited about the new space so that it'll give us the opportunity to roll out a few programs that we've toyed with at the old location, but we really want to roll out in this location. One of the big ones, and this is not just here, this is nationwide, but Colonial Pharmacy is offering a program called Sync Fill.
Okay.
And basically what that program entails is that we get all your prescriptions so that they begin and end all at the same time. In pharmacy, for the future, we're trying to move from what's called a will call model. In other words, you call us or you show up at the pharmacy and we get the prescription ready and you wait, to an appointment-based model where the pharmacy coordinates your prescriptions, makes a phone call, verifies that you're ready for your prescriptions, gets them ready, and then sets up a time, if that's what is desired, when you can come in, pick up your prescriptions, talk to the pharmacist about any concern. During this appointment, we can discuss things such as immunizations, whether you're due for a flu shot, a shingles shot, a pneumonia shot. If you're concerned about maybe your blood pressure is high, we can sit down and take a blood pressure reading.
Wow.
Things on that idea. Expanded health offerings, I guess you could say.
With the limited time that you have in the doctor's office now, I think that's a tremendous benefit. You're really getting another opinion, and you're getting additional care.
Right, you are, and it will dovetail in with your doctor's services. So,
Right.
for example, a blood pressure reading. If there's something of concern, it's a pharmacist that can contact the physician's office, or if it's immunization, it all gets done here quickly, conveniently, and then it gets transmitted to the doctor's office for the full record.
Right, so you can now come here and get some immunizations as well.
Correct. We have 3 immunizers. Happy to announce that on Friday, we had Cindy become a certified immunizer, so now we have 3 here. It covers just about every store hour, every opening hour.
Good.
So that can be on a walk-in basis, no appointment necessary.
Wow, and
Yeah.
tell me just a few of the immunizations you can get here.
So the big 3 that we see are the seasonal flu. There are 2 types of pneumonia vaccines.
Okay.
And then there's a brand new shingles vaccine that's out on the market
Sure.
that's up to 90% effective. So we're seeing
good.
quite a bit of revaccinations and new vaccinations with this new shingles vaccine.
That's terrific. And I like for somebody who's on multiple medications to have the contact with the pharmacist. It can get confusing.
It can.
Yeah.
It can get confusing, and like I said, with that appointment based. Here at Colonial, we always have, or 90% of our store hours, we have 2 pharmacists on.
Yeah.
So there's always a pharmacist that can break away. We have a brand new consultation room. We can go behind closed doors. We can sit one-on-one and have that conversation of medication and what may be happening and what some of the concerns are. Then they can be addressed right at that time of the monthly pickup.
I love that. That so ties in with you being such a great local provider,
Yeah.
giving the local service too. Talk about the blister packs, because that's again another great service for somebody who's on a lot of medications.
Right. So for someone who's on, like you said, on a lot of medications, the big push in pharmacy now is take your medications the way they're prescribed. For someone in Sync Fill, if we identify someone who maybe has a few doses of medication left over where they shouldn't, we can suggest a blister packaging program where we take your monthly prescriptions, and it's just like you would lay them out in a daily planner, only we do it for the month. So there's no concern to the patient. The blister pack is clearly marked with the day of the week, the date of the month, has
Yes.
all their medication inside one blister. It looks like a little medicine cup, like a
Right.
nurse would give you in a hospital.
Sure.
And that way you know for sure whether you've taken your medications
Right,
or
you
not.
forget sometimes. If you're supposed to take it in the morning, you think, was that yesterday that I took it or was it today?
Right.
Absolutely.
Very clearly
Yeah.
marked for a patient to see whether they've taken it or not.
That's great.
Yeah.
Super. Okay, well, good. Well, I think people need to come in and really see this for themselves. See that nice new window you've got for pickup, the consultation room.
Yeah.
Nothing beats a trip here, even though we can talk a little bit about it. So
Correct.
wonderful new programs. Thank you so much.
Thank you. Thank
Take
you.
care.